Hello, hello. My name is Mike. I'm 34 years old. I live in beautiful San Diego, California. And about a week ago, I had a L5-S1 disc replacement, and this is an account of my experience. In case someone may be considering the surgery, I want to go over what led up to my decision to have surgery, my experience of the surgery, and the recovery so far. I describe myself as a health minded and athletic person. I'm big into sports and healthy eating and lifestyle habits. My pain started a little over 4 years ago in fall 2021 as a result of doing jiu-jitsu while I was living in Maryland. After training one day, I got home and noticed extreme soreness in my lower back and sciatic pain shooting down my left leg that got progressively worse over the next few days. I don't remember a particular incident during training that I can point to as the cause of the injury, but something happened that day that really screwed up my back. Going forward, I did nothing about the injury besides reducing my activity levels and hoping it would resolve on its own. Pain became manageable, and I eventually moved to California in 2022. Here, I increased my training frequency for just about everything. San Diego is a gorgeous place and inclines you to get off your butt and do stuff. And as a result, my back pain, most notably my sciatic pain, increased and became pretty tough to tolerate. So I decided to see a doctor about it. I got an MRI done of my back and found out that I had a severe L5-S1 disc herniation. I found an orthopedic surgeon here in San Diego named Mark Nelson who specializes in spine care. And he eventually performed a microdiscectomy on me in December 2023. It was a successful surgery and worked incredibly well to remove the sciatic pain I was experiencing. However, afterwards, I was left with a lot of lower back soreness, stiffness, weakness, and instability. So, fast forward about 2 years, and I decided to seek additional help from Dr. Nelson because it had been a long enough time and I was still experiencing debilitating back pain from mundane activities such as tying my shoes, sneezing, getting in and out of a car, especially in the mornings. Mornings were very rough. After waking up, I'd moan and groan, hobble around like an 80-year-old man. I'd eventually make my way to the gym and do some activity and stretching, and my pain would become manageable. I'd say it would go from like a 7 out of 10 to a 3 or 4 out of 10. Based on an updated MRI, I was told that the L5-S1 disc space was severely collapsed due to the herniation, and so I was experiencing arthritic pain from the vertebrae grinding against each other. After consulting with Dr. Nelson, he suggested disc replacement as a possible solution and referred me to Dr. Ramin Rizadeh, who is an orthopedic surgeon located here in San Diego and is the premier lumbar disc replacement surgeon in San Diego. After consulting with Dr. Rizadeh, he agreed that an artificial disc replacement was the appropriate solution for someone my age with my health. Keep in mind, at this point, it's over 4 years since the original injury. It's been about 2 years since the microdiscectomy, and I'd been white knuckling it most of this time. I've been living in constant pain and trying to manage it as best I could with physical therapy, exercise, anti-inflammatories. But the pain wasn't going anywhere, and I didn't want to go the route of injections or stem cells or other alternative therapies, so I decided to go with disc replacement surgery. It's now a little over 6 days post op, and so far, so good. I'm in good shape. Procedure was smooth. I was told it took about 2 hours. I stayed one night in the hospital. The incision to access the disc and do the replacement was made on my abdomen below my belly button. I'll show you what it looks like. Still got a bandage on it, but there it is. Not too bad. At the moment, my pain is under control. I'm walking well with very little discomfort. Each day I'm in less pain and feeling stronger. The incision site on my abdomen is sensitive. My lower back is still sore. I have a little sciatic pain in both legs, which I think is from the nerves being stretched. I'd say the incision site is the most annoying part. You don't realize how much you use your abdomen until every little movement bothers it. Immediately after surgery, lower back pain was pretty intense. I'd say like an 8 out of 10, but thankfully the hospital had good pain meds. At the moment, I'd say my pain overall is a 3 out of 10, and that's pretty good given that I haven't had pain meds in over 24 hours. The first 3 days, I felt extremely worn out and debilitated, but I think that's expected for any surgery of this magnitude. The fourth day post op was the first day post surgery where my energy started to return and I started to feel normal. I'm very grateful for Dr. Rizaday doing this procedure and all that Dr. Nelson has done to help me. Dr. Rizaday and Dr. Nelson are both very talented people, and I'm optimistic that this disc replacement surgery will largely resolve my lower back pain. I'll wait until I've had a couple months to heal to give an official recommendation of the procedure, but just wanted to give a brief overview of what you can expect for anyone who's interested. I'll share my MRI images somehow. Check the video description. But if you have any questions, leave me a comment. And thanks for watching.